Next in our video series of ozone, we're going to be talking about the different medical uses of ozone. Now, I could go into the depth and talk for hours on this, but we're going to do a quick skim of the topic as far as the medical uses of ozone. And it's this simple. The main three different versions of ozone therapy is something called insufflation, which is where you use the gas directly to kind of bubble or give to a person. The next big one is joint injections, and then the one that is the most known about is intravenous ozone. Now, in the intravenous IV ozone, it is not where we inject the gas directly. So let's start at the top. The top is called insufflation. Ozone insufflation is very common, very easy, very safe. Ozone gas is toxic to the lungs, so it is something you cannot breathe, or at least in significant doses, you cannot breathe. The lungs cannot handle ozone, and so it can be damaging. So we do, as far as ozone insufflation, you can do in the nose. Now, obviously, you breathe through the nose, so you cannot do ozone gas directly into the nose. You actually have to boil it through, run it through some oil, and as it bubbles through the oils extract the ozone terpenes, and those ozone terpenes is what you're actually breathing, so it's safe to breathe. It's really not that dangerous to breathe because as you breathe it, you immediately start coughing, so you know that you are getting too much ozone directly down to the lungs. So when you're bubbling it through the nose, you know that you're not really inhaling too much because your lungs would hurt and you would start coughing. So the reason why you would do it nasally, remember in our previous video we talked about how ozone is a topical disinfectant. Well, when you bubble it through the nose, it also is a disinfectant. So if you have chronic sinus issues or mold issues in your sinuses, ozone can actually kill that. We've actually had several people have what's called die-off when they have too much mold in their sinuses or too much bacteria, marcons, whatever it may be. If you give them ozone and their body's not prepared for it, they can have die-off from those bacteria. Ultimately, it's something that they kind of need, but they would do less time and then give it more time in between doses. So in the nose, it's useful for mold, chronic sinus infections. We can also do it through the ears. Now, once again, you're not breathing through your ears, so you can do more of the gas straight through the ears. We actually bubble it through water when it's going through the ears, but this is ear insufflation. This can be useful for wax buildup, ringing in your ears, any kind of ear pain. You have to remember that your eardrum is not that far from your brain tissue, so anything you treat in the ears can actually help with brain fog or anything even further. I was just talking to a patient this morning who notices every time she does an ozone insufflation in her ears that her brain fog improves. She believed in it so much and it worked for her so well, she actually bought one of the machines and does it at home routinely. The part that Dave Asprey probably made the most famous is vaginal and rectal ozone insufflation. As strange as this sounds, it's even hard for me to say, as strange as this sounds, it actually has a lot of different therapies. Now, we kind of say vaginal and rectal ozone is such high dose that you can compare it to intravenous ozone, but really only at low doses. There's only so much you can get into the vagina or rectum to equate to how much it is in the IV, and you can't give it nearly as fast for those places, so IV is still different. Whenever you insufflate it through the vagina or the rectum, obviously women can do vagina, men have to do rectal. We still recommend rectal for most women. It's a better absorption and more comfortable, if you will. But remember, ozone is topical, so although it will act somewhat like an IV ozone because your body will absorb it, the topical aspect of it, it can help with yeast infections or any kind of vaginal disorders. It can help with bowel issues as it's bubbling through the rectum. And then I put in a note that's similar to IV in the sense of you will absorb the ozone, but whatever it might kill along the way or repair, that you get the added benefit of whatever area you're going through may help. It's also useful in any kind of musculoskeletal injuries. I put joint injections here, but it doesn't matter if it's arthritis, chronic back pain, disc issues, if it's tendonitis or any kind of ligament strains, anything like that, you can actually inject ozone, the gas, directly into those tissues. Now, as a medical doctor, we've never injected air into people. So when I first started doing ozone injections, it was a little unusual injecting air into people, but this is a gas that's readily used by the body and it's not dangerous when given correctly. So in joints, it can help with arthritis, discitis, tendonitis, anything itis in the body. Ozone injections can help, and it's cheap and effective. As far as IV ozone, there's a separate presentation, separate video on just that in general. But IV ozone is multiple factors. It's an antioxidant, it's an immune booster, it's an energy booster, all kinds of things. I will go into that separately. Some comparable therapies to ozone that you may already hear of but didn't know that ozone's similar is hyperbaric chambers. That's a similar therapy. Doing a high-dose vitamin C infusion is actually very similar to doing an ozone infusion. And then ultraviolet blood irradiation, UVBI, is also another thing that's similar to ozone therapies as somewhat of a stressor. We'll go into ultraviolet blood irradiation in another presentation. The other two I will talk about in another video series, not this one. I think that's it. Yep. So next video, we're going to do a quick video on how is ozone produced. I think that's pretty cool. So we're going to go into that next.